Hello, and welcome to Own Your Retirement. My name is Albert Lalonde from Kaizen Financial. If you'd like more information about what you hear during our show today, give us a call at 586-752-7008 or visit us online at www.kaizenfinancialinc.com. That's Kaizen, Kaizen. And then while at my website, click on our podcast page to check out our past shows and also to subscribe to our program on Apple Podcasts, Spotify, or Amazon Music. All right, it's official. Medicare costs will eat up much of older Americans' Social Security cost of living adjustments next year. In fact, a USA Today article titled, "It's Official, Medicare Part B 2026 Premium Will Eat a Big Chunk of Social Security COLA." Well, we're going to cover this article because it has some excellent details of what's happening for 2026 and your healthcare costs. Now, the standard monthly premium for Medicare Part B, which covers outpatient care, doctor services, durable medical equipment, and preventative services, will be about $202.90 in 2026, according to the Centers for Medicare and Medicaid Services. Man, that is up $17.90, or nearly 9.7% from 2025. Now, it's smaller than the $21.50 increase that Medicare trustees had projected earlier, but man, it's still the second largest jump in program history and more than triple the 2.8% Social Security raise for next year. So what does this mean to many seniors? Well, see, another hit to their standard of living is what this does for them. And before we go any further, though, man, let me bring in my co-host, Tony Shore, someone who knows rising costs so well. I'm half convinced he's been personally tracking them with a magnifying glass and a coupon book, right, Tony?
Well, pizza prices. I keep a close eye on those, Albert.
Love it.
But seriously, great to be here. Thanks for having me on the show. And what
Yes.
an important topic today. But before we continue with that, I have to say this is our final show of 2025. So
Yes.
we should wish all our listeners and viewers out there a Merry Christmas and a Happy New Year, right?
Definitely. Happy,
Yeah.
happy holidays, everyone.
Yeah.
Enjoy the family and the winter excitement.
Yes, yeah. Happy holidays to our listeners and viewers out there. But I know that a lot of our listeners and viewers know exactly what you're talking about here, Albert,
Mhm.
because Medicare increases aren't just about numbers on a chart. They actually affect people's lives.
Yes.
They affect real budgets, real lives. And when Social Security can't keep pace, even though there's a cost of living adjustment, it's not very much compared to the increases we've seen across the board with healthcare costs. So it underscores just how important this all is and how important it is to stay proactive and have planning so you can make sure your financial strategy can absorb changes like this. And the only way you're going to accomplish that is by working with somebody like yourself, a trusted financial services professional who's going to look at the big picture and incorporate these costs into your overall plan, and especially your plan for retirement, right?
Yes, and you know the big thing on this is not just the cost upgrade for those that are on Medicare and things like
Right.
that. It's also affecting what they do then for the rest of their, let's say, expenditures for the month. They may cut
Right.
back on other, expenditures because of the healthcare costs going up, which then affects our economy, affects everything else. And so this is
Right.
big. It's more than just, hey, it cost me more for my insurance this year.
Yeah, and we were talking before the show, Albert, about how it's going up. Healthcare, especially health insurance, is going up exponentially across the board. No matter if you're still employed in your working years, getting it through an employer, whether you
Mhm.
pay for it on your own or self-employed like yourself, own your own business, or whether you get it through the exchange
Right.
or Affordable Care Act, it's going up for everyone across the board exponentially. So you have to make sure you're planning for it, right?
Yeah, and here's what's the crazy thing too when they look at those powers that may be to make these decisions, they're looking at again where poverty level is and all that. And if you look, according to that article, seniors were the only group who saw an increase in poverty in the previous year, 2024. Every
Mm.
other group either stayed the same or improved.
Wow.
So that's the big key. It's that retirees, it's the seniors, and when
Yep.
retirees look at Medicare Part B, especially on the increase, many will feel as though it's taken a significant portion, if not most, of their cost of living adjustment. And they're absolutely right. And it's another example of how persistent cost increases continue to pressure household budgets. And it's not just about tariffs and everything like that. That's where we're being misguided. It's the healthcare right here at home that's affecting a lot of seniors right now.
Yeah. Yeah, it is affecting a lot of people out there, and I think that's critical. That it really does matter. I
Mhm.
think that a $56 a month increase sounds okay at first glance, but then losing nearly a third of it to Medicare premiums can
Right.
be a setback for somebody
Yes.
on a fixed income. So, for a lot of retirees, $38 isn't extra spending money. It's what helps cover essentials. And so you've got to understand how these changes interact. Social Security increase, Medicare cost increases, health insurance increases. It's crucial to keep your financial plan on track to understand these changes.
Yeah. And then let's talk about something that's going to matter a lot for people on the lower end of the Social Security benefit scale, the hold harmless provision. With such a large increase in Medicare Part B, this rule will likely kick in for recipients who receive $640 a month or less in Social Security.
Hmm. So that provision is really there, Albert, to make sure people aren't pushed backwards, right? It prevents
Yes.
the Medicare B premium increase from being larger than the person's COLA. If the premium goes up more than their benefit, they're at least protected there, right?
Yes. And in that scenario, the beneficiary doesn't have to pay the full premium increase, and the portion they don't pay gets spread across people who aren't protected under the rule. See? And
Sure.
so for let's say someone getting, let's say, $640 a month, next year's 2.8% COLA adds up to just under $18. And then without hold harmless protection, that 1790 Part B increase would completely wipe out that bump for them.
Wow. And that's a huge difference for somebody living on that income. It's interesting how much this varies year to year, isn't it?
Oh my gosh, big time. It really does. And if you think back in 2022, only about 1.5% of beneficiaries needed hold harmless protection. Part B rose by about $21.60. But the average Social Security increase was $92. So most people could absorb it. But in
Yeah.
2017, now, when premiums jumped 10%, or about, let's say, $12.20, and the COLA was only 0.3% or roughly $5, about 70% of the enrollees paid a lower than standard premium because of the hold harmless rule.
Interesting. That's a dramatic swing right there. And it
Mhm.
shows why retirees need to understand how these rules work because the impact it has on their actually monthly income can change a lot depending on the year, then.
Yeah. Now understand too, the hold harmless provision is helpful, but it won't fix everything. It can protect seniors from big increases in Medicare Part B premiums, but it doesn't shield them from every cost that healthcare has risen in.
Yeah, and that's partly because a lot of retirees have other automatic deductions coming out of their Social Security checks.
Oh, yeah. I mean, let's say if someone has premiums for Medicare Advantage or for a Part D prescription drug plan deducted automatically. Increases in those premiums can still reduce their Social Security benefits. Now, remember, Part D is optional, but it covers prescription medication. So many people actually rely on it. And some Part D plans are seeing big jumps. In 2026, certain plans are increasing premiums by as much as $50, which is the maximum allowed under the Part D premium stabilization demonstration program. That's according to KFF, a nonprofit, nonpartisan research group whose data is cited in that article.
Well, a $50 increase is no small thing, especially
Mm-mm.
for someone already trying to make a tight budget work or in
Yes.
retirement. So, retirees are also seeing fewer choices out there, right? We talked about that a little bit before the show, too.
Yes, they are. In fact, the number of standalone Part D prescription drug plans has been cut in half since, get ready for this, 2024.
Right.
Which
Just in the
which
last
really
year. Yeah.
yes, which really limits options for people trying to find something affordable or either better suited to their needs.
Yeah, I know in many areas, my parents live in Minnesota, the Advantage plan that they had been on, it just went away this year. Like
Mhm.
3 months, ago, they just got a notice saying, "Hey, we're not gonna carry Advantage plans anymore, so you'll have to find something else." It's like and that's happening across the board.
Yeah.
To
Oh, yeah.
to a f to a lot of people, right? And
Mhm.
so, I think that's really, really, tough. So even if someone qualifies for Hold Harmless, you could still see your net Social Security benefit shrink because of these other premiums, though, you're talking about, right?
Yes, for sure. And one more important point here. Not everyone is eligible for hold harmless in the first place. So you have to remember people who are not protected include like new Medicare enrollees, individuals who aren't receiving Social Security benefits, and high income earners.
Yeah, and that's a good thing to note because there's often an assumption that the rule applies to everyone, but it clearly doesn't.
Right. Now, we've talked about premiums, but there's another piece that affects what retirees actually pay out of pocket, and that's deductibles.
Right. A lot of people don't realize you're still going to have premiums, deductibles, and copays,
Mhm.
costs like that, even if you have Medicare. And even if somebody can manage that premium increase, the Medicare premium increase, the deductible is what they have to cover before Medicare starts paying its share, right?
Yeah. And next year that deductible is going up. In fact, the annual deductible for all Medicare Part B beneficiaries will be $283 in 2026. Now, that's a $26 increase from the 2025 level of 257 according to the Centers for Medicare and Medicaid Services.
Sure. So between higher premiums and higher deductibles, Medicare enrollees will be facing higher costs on several fronts then next year.
Yes. And now here's an interesting angle. Could the Medicare Part B premium have been even higher?
Hmm.
According to CMS, yes, it actually could have been. In fact, according to the article, earlier policy changes that reduced spending on skin substitutes prevented the Part B premium from rising an additional $11 per month there, Tony.
Wow. And that could be a significant difference over time. So, what exactly changed to keep that increase from happening?
Well, it comes down to the 2026, what they call the physician's fee schedule final rule. So CMS finalized changes that are expected to reduce spending on skin substitutes by about 90% while still maintaining patient care. So these products, whether biologic, synthetic, or even biosynthetic, are designed to mimic human skin and are used to cover and treat chronic wounds, like, let's say, diabetic foot ulcers. Now, the administration reclassified them so they're no longer billed separately, which is where those big savings come from.
Wow. So, it made a difference for everyone across the board just by changing that one area and that coverage.
Mhm.
And I know, according to the article you referenced earlier, that reclassification helped keep the premiums lower than it otherwise may have been then.
Yeah, and it's worth noting though that the Medicare trustees had already estimated back in July that the standard monthly Part B premium would rise by $21.50, taking the 2026 premium to $206.50. But the actual increase turned out, like I said earlier, only $17.90, bringing it to $202.90 instead.
Yeah, we'll take what we can get, right?
Heck yeah. Now, let's keep going with today's conversation about Medicare by next looking at a recent AARP article, 7 changes coming to Medicare in 2026. And let's start with one of the biggest changes for 2026, lower Medicare negotiated drug prices. Beginning in January, 10 high cost prescription drugs will be available at reduced prices.
Yeah, and this is just the first round of these negotiated prices, right?
Mhm.
And it was made possible by that prescription drug law that was passed back in 2022.
Yes. In fact, that
Yeah.
law allows Medicare to negotiate directly on certain high cost medications. These 10 drugs include treatments for arthritis, blood clots, cancer, and diabetes. Now, the goal is to make these medications more accessible, more affordable, and ultimately improve the quality of life for millions of beneficiaries.
Yeah. And these negotiated prices have to be available to all eligible Medicare beneficiaries starting January 1st, 2026, right?
Yes, yes, they do. And just as importantly, all Medicare Advantage prescription drug plans and standalone Part D plans must cover these 10 medications. So beneficiaries across Medicare should have access to the lower prices.
So, what kind of savings are we talking about here?
Well, for beneficiaries, out of pocket spending is expected to drop by about $1.5 billion in 2026 alone. And
Wow.
those savings will continue year after year. Now, to give some perspective, if these negotiated prices, let's say, had been in place back in 2023, Medicare itself would have saved around $6 billion. And another notable change for 2026 is that some Medicare enrollees may get an additional chance to switch plans. And this ties directly into updates that CMS has made to the Medicare Plan Finder tool.
Okay. And that plan finder tool is what people use during open enrollment from October 15th to December 7th to compare Medicare Advantage and Part D plans, correct?
That is it, correct. And for 2026, CMS has added information about which doctors and other healthcare providers are included in a Medicare Advantage plans network. So now many consumers won't have to leave the plan finder to check if their doctors, hospitals, or specialists are in a plan's network. Previously, people had to go to each insurer's website or make phone calls or had to work with the broker.
Yeah, that's a big improvement, but it sounds like some of the data isn't complete yet, right?
Correct. Provider, let's say directory information isn't listed for all plans at this point. CMS will continue adding and updating those details as insurers send it to them.
Okay. So before we keep going with today's conversation, let's take a moment here to let our listeners and viewers out there know how they can schedule that no charge consultation with you and your team to ask questions or get more
Yeah.
information.
Folks, if you're concerned about the your Medicare costs and how much it's going to take a hit into your everyday living and retirement, just give us a call, 586-752-7008, or visit us online at www.kaizenfinancialinc.com, Kaizen, Kaizen. And remember, scheduling a consultation only takes a few minutes, and we're always happy to work around your schedule.
All right. Well, before that quick break, we were talking about the Plan Finder tool and
Mhm.
figuring out what to do. And that mainly impacts people comparing Medicare Advantage options, right?
Yes. And if you remember, about half of all of Medicare beneficiaries are in Medicare Advantage plans, which
Yeah.
are the privately run alternative to the original Medicare. Now, these plans limit members to their network providers, and out of network care can cost more in some cases. And then beneficiaries must pay the full amount.
Wow. Okay. Whereas enrollees in original Medicare can see
Mhm.
almost any doctor who accepts Medicare, right?
Yes, and that's roughly about 90% of all non pediatric physicians. Now,
Wow.
here's where the special enrollment opportunity comes in. If someone, let's say, uses the Medicare Plan Finder during their first 3 months on a new Medicare Advantage plan, they'll be eligible for a one time special enrollment period in 2026 to switch plans. Okay. Another change coming in 2026 involves Part D deductibles and spending caps. So the out of pocket limit for prescription drug costs is going up, Tony.
Okay. So that's the cap that applies to both standalone Part D plans and drug coverage that comes with Medicare Advantage plans, right?
Yes. In fact, the cap was set at $2,000 in 2025, but in 2026, it rises to $2,100. That's a $100 increase,
Hmm.
or let's say a 5% adjustment, which reflects the increase in average spending on covered Part D drugs during 2024.
Yeah. So does that mean beneficiaries who hit that out of pocket limit will need to plan for slightly higher costs next year?
It does. And there's another increase to note as well. The maximum Part D deductible is also going up. So in 2026, it will be $615 compared to $590 that we have currently in 2025.
Well, they're hitting you coming and going.
Yes, they are.
Yeah, and you've noted in previous shows that some Part D plans do offer lower deductibles or even no deductible at all, depending on the plan design.
Yes. And so it's another area where comparing plans carefully really matters,
Yeah.
especially with these annual adjustments that they're doing. Okay. Now, there's also an important update involving the Medicare prescription payment plan. So in 2025, beneficiaries in both standalone Part D plans and Medicare Advantage plans with drug coverage had the option to pay their out of pocket prescription costs in monthly installments instead of all at once at the pharmacy. Now, combined with the new $2,000 out of pocket cap, this meant someone facing a $2,000 bill in January could spread that out into payments of about $167 a month.
Yeah, and that made those big, early year expenses much more manageable for a lot of people. And what
Yes.
changes there in 2026?
Well, the big change in 2026, and anyone who participated in the program in 2025 will be automatically re enrolled. Beneficiaries won't need to sign up again unless they choose to opt out or switch to a new Part D or Medicare Advantage plan. If they do switch plans but still want to keep the monthly payment option, they just need to contact their new plan to continue.
And hopefully that means staying in the program should be seamless for most people, right?
Exactly. And according to the article, CMS said the automatic renewal actually eases burden for both participants and plan sponsors. And for those who decide they don't want to stay in the program, their plan must process the opt out request within 3 days. Now, another major development for 2026 is a new prior authorization test in original Medicare. So this is a 6-year experiment starting January 1, and it could require millions of beneficiaries in certain states to get advance approval before Medicare covers specific medical services, procedures, or devices.
Hmm. That's a big shift. I mean, prior authorization is common in Medicare Advantage, but
Yes.
not in original Medicare.
Right. And that's why this pilot is significant. If the experiment is successful, it could lead to wider use of prior authorization in original Medicare, potentially involving artificial intelligence, algorithmic tools to help make coverage decisions. Now, the program will run through December 2031 and could affect up to 6.4 million beneficiaries across parts of Arizona, New Jersey, Ohio, Oklahoma, and Washington.
Wow. Okay. So this is all very interesting. What's the purpose of the pilot, though?
Well, the article notes that says that it's aimed at speeding up coverage decisions and cutting wasteful spending on at least 16 services, procedures, and devices that are considered especially vulnerable to fraud, waste, abuse, or inappropriate use. Technology companies participating in the pilot will be paid based on savings generated from denied medical claims. And that payment structure has raised concerns from groups like the American Medical Association and consumer advocates.
Yeah, and I can see why. I mean,
Yeah.
there have already been questions and concerns about how this prior authorization is
Mhm.
handled with Advantage plans, especially when delays or denials can impact patient care or create burdens for caregivers, right?
Yes. And this pilot comes at a time when lawmakers and oversight groups have been examining those issues that you've been talking about closely. Okay. So we'll see where it goes. Now, another program wrapping up in 2026 is the Medicare Advantage value-based insurance design model. So more than 7 million people enrolled in Medicare Advantage, including many with chronic illnesses and limited incomes, may lose access to certain supplemental benefits when this pilot ends on January 1.
Yeah, and those were benefits designed to remove barriers to care, right?
Yeah, you're exactly right. In fact, since 2017, the motto has allowed plan sponsors to offer tailored benefits such as reduced drug costs, food assistance, transportation to medical appointments, and support for managing chronic conditions. It was, in fact, targeted primarily to low income beneficiaries, including those duly eligible for Medicare and Medicaid, and those who qualify for extra help.
Okay, so why is the program ending?
Like anything else, cost.
Yeah.
According to the article, the model was intended to modernize Medicare Advantage and test whether these extra benefits improved health outcomes and reduce expenses. But it ended up being very expensive. In fact, $2.3 billion it cost in 2021 and $2.2 billion in 2022, thus prompting CMS to shut it down. Now, finally, with all that stuff, there's a notable change to supplemental benefits offered to Medicare Advantage plans. So back in 2018, a bipartisan law expanded the types of non-medical services that plans could provide to chronically ill enrollees. These are known as special supplemental benefits for the chronically ill.
Yeah, and that's a good thing because those benefits you're talking about didn't have to be directly medical as long as they were expected to help improve or maintain somebody's health or function, right?
Yes. But starting in 2026, CMS is tightening the rules and limiting the types of allowable coverage. There are several benefits that will no longer be permitted under Medicare Advantage plans, including alcohol, cannabis, and tobacco products, certain cosmetic surgeries and procedures, such as, let's say, facelifts, treatment for facial lines, and remedies for collagen or fat atrophy, funeral planning and expenses, life insurance or hospital indemnity insurance, unhealthy foods.
Yeah. Well, and those are probably not ones that should be covered anyway. A lot of them,
You
I
say,
would say, I mean, alcohol, but beneficiaries who do rely on some non-medical supports will need to take a closer look at their plan and what it continues to offer and what it won't cover
correct.
anymore. Yeah.
And that's why reviewing coverage during open enrollment will be more important than ever heading into 2026.
Yeah. Well, I think we've had a great conversation today, Albert. Is there anything else you want to add before we go?
Folks, if you have questions about your retirement, your financial strategy, or just questions on Medicare and Social Security, visit my website, please, at www.kaizenfinancialinc.com, Kaizen for Kaizen, or call my office at 586-752-7008. And we'd love to help you protect your savings, feel confident about the road ahead for your retirement, because that way you can own your retirement.
Yeah. All right. Well, thanks, Albert. Listeners and viewers, thanks for tuning in. And that does it for today's episode of Own Your Retirement with our host, Albert Lalonde.
Take care, everyone. Happy New Year.